Hey guys, welcome and welcome back to my channel. This is Dr. Prasanjit Das, currently JR2 in the Department of Pharmacology, AIMS Kalyani, and I am back with one of my seminars. So, without wasting any time further, let's get into today's topic. So today I will be discussing about the screening of drugs for respiratory diseases. So in today's session I will be covering this topic under the following headings, that is the introduction, then we will be moving on to the different screening methods for individual diseases of the respiratory system, that is lung cancer, then we have lung fibrosis, then we have COVID-19, then we have emphysema, then we have COPD, that is chronic obstructive pulmonary disease, then we have asthma, and finally the conclusion of the entire seminar. So let's move on to the first slide, that is the introduction. So we know that the global burden of respiratory diseases is enormous, and as a result it has led to suffering and death of many people prematurely every year. So this has led to increase in the morbidity and also in the mortality of the individuals every year. So that's the reason why we had to develop new and advancing drugs in the cases of the respiratory disease so as to manage this condition. So the failure rates of the drugs evaluated in human clinical trials are usually very high. So to reverse these trends and to minimize the cost of drug development for the respiratory disease, what we have to do is we have to eliminate the ineffective drug candidates as early as possible by employing new, efficient and accurate preclinical screening approaches. So even before we are going to the clinical trials, it is better to remove the ineffective drug candidates by appropriate preclinical screening approaches. So animal models is one such method, and it has been the mainstay of pulmonary research as it recapitulates the complex physiological process which occurs in the body of the human beings in the animals. Then it also stimulates the multi-organ interplay, then it mimics the different diseases, that is the different phenotypes of the disease, and it also has the capacity to help us understand the pharmacokinetic behavior of the drugs, that is its absorption, distribution, metabolism and excretion. So this is the reason why animal models are the preferred ones in preclinical screening approaches for the development of new drugs for respiratory disease, or it can be in any other diseases. Now let's come to the first disease, that is the lung cancer. So for lung cancer we have in vitro models and in vivo models. So in vitro models means outside the body and in vivo models means inside the body, that is basically inside the animal. So in vitro models we have different types, that is 3D vascularized lung cancer on a chip, that is VLCC. As you can see here, this is the chip here, and then we have patient derived lung cancer organoids. So organoids are nothing but the miniature form of organs. So in 3D vascularized lung cancer on a chip model, this model basically mimics the in vivo cellular microenvironment of the human being by using a lung decellularized extracellular matrix, that is lung decellularized extracellular matrix, then tumor spheroids, that is the spheres of the tumor cells, and induced protein angiogenesis, that is basically to mimic the blood vessels which are present in the lung cancer. And this model is far much better than the 2D platforms, that is 2D culture methods for screening the drugs. Then next we come to the patient-derived lung cancer organoids. So this model is based on the patient tissues, that is we are taking the patient tissues because it can easily recapitulate the tissue architecture of the primary lung tumors, and it will respond to the drugs differently based on the presence of the genomic alteration which is present in that particular lung cancer. So different lung cancers will respond differently, and organoids means basically the miniature form of the organs. Now coming to the disadvantages of using these in vitro models, first thing is that it lacks an immune compartment which is seen in normal individuals, that is the normal immune system. And next thing is difficulty in co-culturing multiple cell types together. So these are the disadvantages of using the in vitro models for screening of drugs for lung cancer. Now coming to the in vivo models, so we have different strains of wild type mice, and different strains of wild type mice have different susceptibilities to cigarette smoke or tobacco carcinogen, which are one of the important factors for causing the lung cancer. So we have different mice strains, that is A bar J and Swiss SWR strains of mice, which are considered susceptible to the cigarette smoke, That is, if we expose this type of mice, that is this strains of mice to cigarette smoke, it will lead to the formation of lung cancer very fastly. And then we have BALB C type of mice, that is, this is the BALB C type of mice which are having intermediate susceptibility to the cigarette smoke for formation of the lung cancer. And then we have other strains, that is C57BL/6, C3H, DBA and B6C3F1, which are relatively resistant to cigarette smoke or tobacco carcinogen. Next thing, there is a significant increase in the incidence of the lung tumors and the tumor multiplicity, that is basically the increase in the number of the tumor cells seen when the mice is being exposed to cigarette smoke. So this proves that cigarette smoke is one of the inducing factor for lung cancer, and the most potent carcinogens in the cigarette smoke is the polycyclic aromatic hydrocarbons, and apart from that we also have tobacco specific nitrosamine. And the different carcinogens like smoke, then we have tobacco, then other carcinogens can also cause lung cancer. So different carcinogens will induce different types of lung cancer. So as you can see, this is the lung cancer here. So what are the different types of lung cancer which can be caused by different types of products? So first we have NNK, that is nicotine derived nitrosamine ketone, that is NNK, and it induces adenocarcinoma of lung. Similarly, we have N-nitroso tris chloroethyl urea that promotes the development of squamous cell carcinoma of lungs. So we have N-nitroso tris chloroethyl urea, which promotes the development of squamous cell carcinoma of the lung, and then we have NNK, that is nicotine derived nitrosamine ketone, which leads to the development of adenocarcinoma of the lung. So this is basically the explanation of this statement. So now let's move on to the next slide. So we have several transgenic mouse models. Okay, so what do we mean by transgenic mouse models? So transgenic mouse models are basically the mouse models which are actually having some of the genes from the human being. So they will be actually replicating the human process, that is the process which occurs, physiological process which occurs in the human, or the pathological process which occurs in the human, even better. So several transgenic mouse models develop the features that resemble those of the human lung cancer, as I've already mentioned, and among them are some of the examples, that is mice deficient in the tumor suppressor genes, because when it is deficient in tumor suppressor gene, then only it will lead to the cancer. So such as tumor suppressor protein 53, that is TRP53, or the mice who are having mutation in the proto-oncogenes, means the proto-oncogenes means the genes which are responsible to get converted into oncogenes and leading to the formation of the cancer. So mutation in the proto-oncogenes, or if there is any deficiency of the tumor suppressor genes, then it can lead to the development of the lung cancer, and that is basically we are inducing it. Basically we are going to create a mutation in the proto-oncogene gene, or we are going to remove the tumor suppressor gene. As a result, we are going to create these transgenic mouse models, that is not the normal one but the ones which we are creating. And apart from the mouse, we can also use ferrets. As you can see, this is a ferret. So ferrets are also used to model the lung cancer, that is we give intraperitoneal injection of NNK, as I've already mentioned, and it will be in the dose of 50 milligram per kg body weight once a month for 4 months, and this will lead to the development of both pre-neoplastic, that is pre-neoplastic and neoplastic, that is both cancerous and precancerous lesions in the lungs of ferrets. So as a result, ferrets can be also used to model lung cancer. Next, we have urethane, which is another potent tobacco carcinogen which is used to induce lung cancer in mice models. That is basically the lung adenocarcinoma. So collectively, these studies show that mouse models can be used to investigate genetic mechanisms and also to discover the drugs for lung cancer. Now let's come to the next condition, that is the lung fibrosis. So lung fibrosis is basically the primary feature of the disease idiopathic pulmonary fibrosis. Okay, So lung fibrosis is basically the primary feature of idiopathic pulmonary fibrosis, and bleomycin is the drug, as we have already studied. This comes in general pharmacology also and in systemic pharmacology, that bleomycin is the drug which is having an adverse effect of pulmonary fibrosis. So what we are going to do is we are going to use bleomycin because it is commonly used to induce pulmonary fibrosis in the mouse models. So we are taking the advantage of the adverse effect of this drug. And for studying lung fibrosis, although mice are preferred, but we can use other animals also, like rats, then we have hamsters, as you can see in this image, hamsters, then we have rabbits, then we have guinea pigs, dogs, and primates are also used in studying lung fibrosis. So what we do is we do the administration of a single dose of bleomycin that is given by the intranasal route at a dose of 0.05 unit per mouse, with or without 4 weeks of rest. That is, for the next 4 weeks we will not give any dose of the drugs in one mouse model, and this results in the development of the significant airway inflammation, as you can see, significant airway inflammation and collagen deposition, which are the features of the lung fibrosis in the human beings also. So next, what we can do is we can also replicate asbestosis. For that, what we have to do is we have to give a single dose of asbestos fibers, which is given by the intratracheal route, and it will induce pulmonary fibrosis, although it may take more than a month to develop the characteristic features such as the collagen deposition, oxidative stress, and fibroblastic foci, but still it is used for replicating asbestosis in the mice models. Now continuing with this, so the chronic instillation of silica into the rat lungs results in the formation of the fibrotic nodules, which are similar to those which are formed in the lungs of the exposed humans. So this is basically used to study silicosis, and in mice the nature of the experimental silicosis which we are going to induce, it will be depending on the dose of the silica which we are giving, the route through which the silica is being given, the length of exposure for which the mice is being exposed to the silica, and the different mice strain, that is the different strains of mouse will be having different susceptibility to the silica for development of the silicosis. And here you can see the intratracheal route of administering silica. So silica can be given by several routes, that is inhalational route, oropharyngeal aspiration, and intratracheal delivery, as you can see here. Next, we have the strains, that is C3H HEN, MRL MPJ, and NZB mice, which are more prone to develop silica-induced fibrosis than BALB-C mice. BALB-C mice is the one which is having white color, and I have already shown it to you in the previous slides. Now coming to COVID-19. So we have various animal models for COVID-19, that is we can use mice, we can use ferrets, we can use golden hamsters for actually screening the drugs for COVID-19. But the most critical aspect which we have to keep in mind is that when we are selecting an animal model, it will be considered appropriate only when there is this viral entry receptor, that is angiotensin converting enzyme 2, present in that animal for the spike protein which is seen in the COVID-19 virus, that is SARS-CoV-2 spike protein. So the entry receptor for this spike protein is the angiotensin converting enzyme 2, so it should be present in that particular animal so as to test the drugs which can be used for COVID-19. Now coming to the next disease, that is emphysema. So animal models of emphysema are basically the tight skin mouse, the blotchy mouse, and the homozygous mutant Clotho mice. So what is the procedure for doing the screening of emphysema? What we do is basically we take male Vista rats. This is a variety of rats which are weighing about 228 plus minus 15 gram, and they are divided into controls, that is the mice which are being treated with saline. Then we have the low dose group, that is the one which is treated with 200 units of human neutrophil elastase, and a high dose group that is treated with 400 units of human neutrophil elastase. This human neutrophil elastase is the one, that is the enzyme which is responsible for destroying the lung tissue, and as a result it will lead to increased spaces of the alveoli. That is what we call as emphysema. So that's why we are using this enzyme. So human neutrophil elastase will be sprayed above the carina of the trachea using a microsprayer without doing the tracheotomy, that is without doing any opening, that is without creating any opening. And 8 weeks after the human neutrophil elastase application, rats will be sacrificed and the lungs will be dissected out to evaluate the morphological changes, that is to see whether the morphological changes resembles to that of the emphysema. And then we are going to measure the following things, that is lung volume and pulmonary mechanics are to be calculated. Here you can see plethysmograph, that is an instrument which is going to record the respiratory movements of the mice. So here we will get the information in the form of a graph. So 8 weeks after the administration of human neutrophil elastase, rats will be anesthetized and then tracheotomy will be performed, and using a whole body plethysmograph, that is what you are seeing here, we will calculate the functional residual capacity, the lung volumes, that is total lung capacity, and the static lung compliance, and all the values will be presented in the form of mean plus minus standard deviation. So the volumes and the lung capacities are to be calculated, that is with the help of this plethysmograph, and this is done after 8 weeks of administration of the human neutrophil elastase. So this will be done for all the groups, that is the control group, the low dose group, and the high dose group. Now coming to the next disease, that is COPD. So it is characterized by airflow limitation that is not fully reversible. So this point is important, that is not fully reversible, and cigarette smoking is one of the major risk factors for development of COPD. Hence, chronic cigarette smoke exposure is given to the mice, rats, guinea pigs, or dogs to cause COPD in them, because cigarette smoking is the causative factor for COPD. And in one experiment which was performed by Lee et al., it reported that there was inhibition of the cigarette smoking induced emphysema and pulmonary hypertension in rat lungs by a HMG-CoA reductase inhibitor. And one more experiment which was done by Martorana et al. Found that a selective phosphodiesterase 4 inhibitor fully prevents the emphysema in mice chronically exposed to the cigarette smoke. So these are the two findings from two different studies which are very important in case of screening of the drugs for COPD. And in screening of the drugs for COPD, the most preferred animal is usually the guinea pig. Also, it is the same in case of asthma. Now coming to the other experiments done for COPD, so we can do acute studies and we can do chronic studies also. So for both the cases, we will take same type of mice only, that is a 6-week-old C57B1/6J male mice will be taken, and in acute studies they will be exposed to either room air or to the smoke of 5 cigarettes for 20 minutes, and in chronic studies the mice will be exposed to either room air or to the smoke of 3 cigarettes per day for 5 days per week for 7 months. That is a long duration, that is for the chronic studies, and only for 20 minutes in case of acute studies. And then antioxidant capacity will be assessed at the end of the exposure in the bronchoalveolar lavage fluid which is obtained from the particular mice. So in acute studies, the mice will be divided into 3 groups of 40 animals each, and these groups were then divided into 4 subgroups, that is of 10 mice each. So each subgroup will be as such, that is no treatment and air exposed, there is no treatment, but the mice was exposed to only air, not the smoke. Then no treatment, but the mice was exposed to smoke. Then low dose of the test compound, that is the compound for which we are looking whether it is effective in COPD or not. Along with that, the mice will be also exposed to smoke. Then high dose of the test compound, and the mice will be exposed to smoke. So these are the different groups which we can see in case of acute studies, and then we will compare it. Next, in chronic studies, 5 groups of animals will be used, that is 1 with no treatment and exposed to air only, no smoke. Then 1 with the drug treatment and air exposed. Drug treatment means the drug which is being already approved for the management of COPD. Then we have no treatment and smoke exposed. Then we have low dose of test compound and smoke exposed, that is the compound for which we are testing the efficacy and the action against COPD. Then high dose of the test compound and smoke exposed. And after 7 months, as I have already mentioned, in case of chronic studies, we are going to expose the mice for 7 months. Animals will be sacrificed, and the lungs will be fixed with 5% formalin at a pressure of 20 centimeter of H2O, and lung volume will be calculated with the help of water displacement. So basically in this what we do is a container comprising of water, and to that we will add the lung tissue, and we are going to press this lung tissue inside the water, so it will displace some amount of water outside, and that is what is calculated so as to calculate the lung volume by the water displacement method. And we will also do assessment of the internal surface area if we have to look for emphysema also in the same mice. Now coming to the most common condition, that is asthma. That is, in asthma, the airway occasionally constricts and it becomes inflamed in response to one or more of the triggers. So it can be cold air, it can be allergen, it can be several other triggering factors such as anxiety, etc. So short-term relief is provided by the bronchodilators, and long-term control is provided with anti-inflammatory agents such as the inhaled corticosteroid, that is budesonide, or by the inhibitor of the mast cell degranulation, that is cromolyn. So to mimic bronchial asthma in animals, a wide variety of animal models have been developed, and the best suited animal is guinea pig, as it was in case of COPD. Now, why is guinea pig the most suited animal for screening of the drugs used for asthma and COPD? So the reason is that, first, the advantage which we can see is that the guinea pig are having similar potencies and efficacies of agonist and antagonist as compared to humans. Basically, they are having good amount of histamine receptors, and histamine receptor is the one which is responsible for causing asthma. So the different agonist and antagonist of histamine receptors will produce the same effect, which is very much similar to that which is produced in the human beings. And next thing is, guinea pig airways are actually very much similar to the human airways, and it is also having the same airway autonomic control and same type of response to allergen. But there are disadvantages also, that is, guinea pigs are lacking several transgenic models. That is, we cannot create much of transgenic models of these guinea pigs. And next thing is, there are only limited number of guinea pig strains. So for comparative studies, we cannot use guinea pig. That is, we cannot compare between two different species and strains of guinea pigs. And also in guinea pigs, there is a prominent axon reflex that is not present in case of human airways. So these are the disadvantages and these are the advantages. So advantage, first, the increase in the number of the histamine receptors. Next, it is having the same type of autonomic control. The airways are very much similar, and the physiological process which occur in the guinea pigs, that is, the response to allergen, are very much similar to human beings. That's why guinea pig is preferred animal for studying the drugs which are used for asthma and COPD management. But the disadvantage is that less transgenic models are there, then we have less strains of guinea pigs, so inter-strain comparativity cannot be done. And then we also have a prominent axon reflex in case of the respiratory system of guinea pig, which is not seen in human airways. So these are the disadvantages. But overall, we will take guinea pig as the best animal for the screening of the drugs for the respiratory disease, mainly the COPD and asthma. Now coming to asthma in vitro models. First we'll start with in vitro models, then we will go to the isolated organs, and then we will go to the in vivo models finally. First, in vitro models, we have binding assays. Example of binding assay is histamine receptor assay. So this method evaluates the affinity of the test compound to histamine H1 receptor. This is done by measuring the inhibitory activities on the binding of the pyrilamine, which is actually an H1 antagonist, to guinea pig brain plasma membrane preparation. So if this thing, that is pyrilamine, is inhibited from binding to the H1 receptor, it means the test compound is binding to the H1 receptor. So with that, we will be able to find whether there is an affinity for the histamine receptor for that particular compound or not. So male guinea pig weighing 300 to 600 gram is sacrificed with CO2 necrosis. Excess amount of CO2 is given to the male guinea pig, and they are sacrificed. Then the brain is homogenized in an ice cold Tris buffer where the pH is 7.5, and homogenate is centrifuged for 10 minutes at 4 degrees Celsius at 50,000 G. So the supernatant which is formed is being discarded, and then the pellet is resuspended in the buffer and again centrifuged. Then the pellet obtained after centrifugation is resuspended in Tris buffer, and aliquots of 1 ml are frozen at minus 70 degrees Celsius. And then in a shaking bath maintained at 25 degrees Celsius, we are going to take 50 microliter of pyrilamine, 50 microliter of the test compound, and 100 microliter of the membrane suspension from the guinea pig whole brain per sample, and it will be incubated for 30 minutes. So we will have different concentration, that is a total of 11 concentrations of this pyrilamine, and we will perform the saturation experiments. With this, we will be able to calculate the parameters, which includes the total binding of the pyrilamine and percentage inhibition of the pyrilamine binding, and also the dissociation constant and IC50 for that particular test compound. And then the values will be averaged with the help of computer, and we will do the computer based analysis. So this is a very complicated process. So what we need to remember is, first, in histamine receptor assay, what we are testing the affinity of the test compound for the histamine receptor, that is H1 histamine receptor. And there is a drug, that is a compound, that is pyrilamine, which is binding to H1 receptor. So what we will do, we will take the plasma membrane suspension, that is brain plasma membrane suspension from the guinea pig, which is having the H1 receptor, and to that we will add the test compound and also the pyrilamine. So what will happen? Some of the H1 receptors will be bound by this test compound, and as a result, we will be able to find what is the affinity of this test compound for the particular H1 receptor and whether it can be used for asthma or not. So that is basically we are calculating the percentage inhibition of the pyrimidine binding to H1 receptor. So this is in short, and we have the entire detailed process as you can see here in several points. So this is just the gist of the binding assay. Now coming to the next method of in vitro models, that is cell culture method. As you can see here, this is called as the Cultex method. So it is basically doing the culture of the bronchial epithelial cells. So human bronchial epithelial cells, so with the help of that we are testing the susceptibility of the bronchoepithelial cells to different concentrations of smoke. That is what is mentioned in this entire point. So after that we will also look for the bronchial epithelial cells, that is the biological parameters which are going to be tested includes the number of the cells, metabolic activity and the glutathione concentration, and these cells will be treated by either the control, that is nothing, or it will be treated by the test compound for which we are checking the activity, and we will also calculate the number of cells which are remaining viable with the help of this WST assay, which is actually a colorimetric method of counting the cells, or we can do the electronic cell counting. So Cultex method used for finding the susceptibility of the human bronchial epithelial cells in cultures against the smoke, and for this in the culture we are going to give the test compound and we will also give the control, and then we will see whether the particular cells are surviving or not with the help of WST assay. So this is basically Cultex method, and recently this method is gaining a lot of attention and is being used nowadays very frequently. Now coming to the tests in isolated organs. So first we will see the spasmolytic activity in guinea pig lungs. So we know there are several autokines such as histamine and leukotrienes which induce bronchoconstriction. Histamine causes bronchoconstriction by activating the H1 receptors. We also have calcium ionophores, that is the molecules which are responsible for the movement of the calcium. They induce the release of leukotrienes via the 5-lipoxygenase pathway, and that can also cause potent bronchoconstriction. So using this method, drugs are tested for their capability of inhibiting the bronchospasm which is induced by either histamine or by the calcium ionophore. So what we do is we will take albino guinea pigs of either sex weighing 300 to 450 gram, and they are sacrificed with an overdose of ether. Then the chest is opened and the lungs are removed and cut into strips of 5 centimeter each, and then it is being placed into the physiological saline solution. Then the lungs are mounted in an organ bath which is containing the nutritive solution, and this nutritive solution comprises of the following components, that is NaCl, NaHCO3, KCl, CaCl2, magnesium chloride, that is MgCl2, then NaH2PO4, Na2HPO4, then we have glucose, that is 5%, and the overall pH of this nutritive solution is 8. And then the bath is bubbled with carbogen, which is basically a mixture of oxygen and carbon dioxide, but the oxygen amount present in this is more than that which is present in the normal air, and then this is being maintained at 37 degrees Celsius. So there is nothing much to understand in this. It is basically the process. We have to remember the steps. And then after that what we do is, under a preload of 0.5 to 3 gram, the tissue is left to equilibrate for 30 to 60 minutes, and then prior to the testing, carbachol, which is going to cause the bronchoconstriction, is added to the bath so as to test the lung strips ability to contract, that is whether it is contracting or not. Then 20 minutes later, two p-values are obtained by adding the spasmogen to the bath and recording contractile force at its maximal level. Following a 20-minute equilibration period, the spasmogen is administered again. The spasmogens commonly which is used are the histamine dihydrochloride, then we have calcium ionophore, then we have leukotriene C4 and D4. 5 minutes after the test compound is administered, the percentage inhibition of spasmogen induced contraction by the test drug is being calculated. So this is the main thing which we are going to do, that is the percentage inhibition of spasmogen induced contraction by the test compound is to be calculated. So that will give us the spasmolytic effect of the drugs in the guinea pigs. Now testing the vascular and the airway responses of the isolated lungs. So this model provides the opportunity of simultaneous registration of pulmonary vascular and airway responses to the lungs. So in this we use the Sprague dolly rats, that is 300 to 350 gram in weight, and they are anesthetized intraperitoneally with the help of phenobarbital sodium, that is 50 milligram per kg. Then the trachea is cannulated and the animal is maintained on artificial respiration. Then rat is being heparinized but with the help of 1000 units of heparin and rapidly exsanguinated by withdrawing the blood from the carotid artery. Then the lung is exposed by the median sternotomy lesion and a ligature is being placed around the aorta so as to prevent the systemic loss of blood. Okay, to prevent systemic loss of blood, then lung is removed and suspended in a warmed, that is 39 degrees Celsius, at a temperature of 39 degrees Celsius, humidified, that is 100%, water jacketed chamber, and the pulmonary artery is also catheterized. Then an external heat exchanger is used to maintain the temperature of the perfusate solution, that is the Krebs-Henselt solution, which is placed in a reservoir and mixed constantly by the help of a magnetic stirrer. Now lungs are perfused using a peristaltic roller pump at a flow rate of 8 to 14 ml per minute so as to maintain the pulmonary arterial pressure of 15 mmHg. The pulmonary arterial perfusion pressure, airway pressure are continuously monitored electronically and then they are averaged and recorded. The changes in the pulmonary arterial pressure and airway pressure after the injection of the test compounds are measured in mmHg and then compared with the baseline value. So these 2 points are the major points, as you can see here. First thing is pulmonary arterial perfusion pressure and then airway pressure. These are being monitored continuously and then they are being averaged. So from this we will get the baseline values, and after giving the test compound, that is injection of the test compound, again we will check for the changes in the pulmonary arterial pressure and the airway pressure, and then again we will do the average of that so as to obtain the values which are seen when the test compound is being given already. So this is about the vascular and airway responses to the isolated lung. Then we have the next test, that is reactivity of the isolated perfused guinea pig trachea. So isometric contractions are recorded with the help of a transducer which is connected to a polygraph. After 45 minutes equilibration, spasmogens are added. The spasmogens which we are going to use are the ones which I have already discussed, that is carbachol, then we have histamine dichloride, then we have calcium ionophore. When the contraction has reached maximum, the standard drug is administered, means the drug which is already shown to have activity against it, means which we are using already, is given. Then the bronchial responses are recorded, then the tissue is washed thoroughly and control contractions are induced again, means with the help of the spasmogen again. So once we have tested the standard drug, then now we are going to give the spasmogen again so as to introduce the spasms and the contraction, and now we will give the test compound. That is, after obtaining the initial contraction again, then the test drug is added and the contractile force is recorded to its maximal level. Now coming to the in vivo models for asthma. First is to look for the bronchospasmolytic activity in anesthetized guinea pigs. So the contraction of the bronchial smooth muscles result on an administration of a spasmogen, and spasmogen I have already discussed. So the method basically permits the evaluation of the bronchospasmolytic effect by measuring the volume of air which is not taken up by the lungs after bronchospasm. So if bronchospasm occurs, what happens is there is narrowing at the airways, and as a result the guinea pigs will not be able to take some amount of air inside. So this volume of air we are going to measure, and then this will give us an idea of the spasmolytic effect when the drug is being given, that is how much of the bronchospasm is being relieved after the administration of the test drug. So here what we will do, we will take guinea pigs of either sex, that is ranging from 250 to 500 gram in weight, and they are anesthetized with 1.2 gram per kg of urethane given intraperitoneally, and it is ensured that there is no spontaneous respiration. Then the trachea is cannulated, one arm is connected to a respiratory pump and the other is connected to Statham P23 dB transducer. The animal is artificially ventilated at a frequency of 60 strokes per minute. Excess air not taken up by the lungs is measured, and it is recorded in a polygraph. The jugular vein is also cannulated for the test drug administration, and the carotid artery is also cannulated for the blood pressure measurement. Next, each animal is placed in a plastic container of 15-liter volume and aerosol of 0.25% histamine solution, which is the spasmogen, at 180 mmHg pressure is being sprayed. The exposure time is about 5 minutes and the test drug is administered orally 1 hour before the exposure. The spasmogen challenge is repeated, and the unprotected animals, means the animals which are not given the spasmolytic, they will actually fall on their sides because of the asphyxia, which occurs because of the bronchospasm, so the animal is not able to inhale. Now coming to the next one, that is the anaphylactic microshock in guinea pigs. So microshock is nothing but a shock which is having a lesser intensity. So in anaphylactic response, histamine is released from the various sites of the body, and antihistamines are useful in various anaphylactic manifestations such as the bronchial asthma, because bronchial asthma is also an anaphylactic manifestation. So introduction of a foreign protein in the body can produce this microshock, that is a less intensity shock. So what we do is we will take guinea pigs 200 to 300 gram in weight, and they are sensitized with subcutaneous injection of egg albumin, and after 3 weeks the animal are exposed to an aerosol of 5% albumin in an exposure chamber, and then they are removed from the chamber as soon as they become distinct, because once we have sensitized the guinea pigs with the albumin, that is egg albumin, and then we are giving it later on, then the guinea pig will be developing anaphylactic reaction, which as a result the guinea pig will become dyspneic, and if we don't remove the guinea pig from the chamber that time, then it might die. So the time from the commencement of the exposure to severe dyspnea, okay, commencement of exposure to this 5% albumin, that is aerosol of 5% albumin, to the development of severe dyspnea, then in severe dyspnea there will be convulsions also. So the pre-convulsion time is being noted, which serves as a measure of severity of the shock. If no signs of shock are seen, even after 6 minutes, then it is considered that the animal is regarded as protected and the pre-convulsion time is taken as infinite. That is, even if we don't see any signs of shock within 6 minutes of exposure, then it will be considered as that the animal is having a pre-convulsion time of infinity. And the degree of protection, that is, which is produced by this test drug, is calculated by this formula, that is P equals to 1 minus C by T into 100. That is, P is the protection, degree of protection, and C and T are the pre-convulsion time of the control and the treated animals respectively. Treated in the sense treated with the test drug. Now we can also induce microshock in rabbits also. So this can be also done, that is, we can use rabbits also for demonstration of the microshock. Now coming to the next one, that is bronchial hyperactivity in guinea pigs. So inhalation of histamine or other spasmogens can induce symptoms like asphyxic convulsions resembling the bronchial asthma in guinea pigs. The challenging agents are often applied as aerosols, which are produced with the help of an ultrasound nebulizer, and the symptoms which we will see after the application of the spasmogens include increased breathing frequency, then forced inspiration, and finally there will be anaphylactic convulsions and then death. So antagonistic drugs can delay the occurrence of these symptoms, and pre-convulsion time can be measured. So this is the way by which we are going to test the antagonistic drugs, their efficacy against this histamine, that is how they are preventing the bronchial hyperactivity. So in this, what we are going to use is, we are going to use male albino guinea pigs, that is 300 to 400 gram in weight. The inhalation cages consist of 3 boxes, okay, 3 boxes, we have to remember 3 boxes, and each is ventilated with an airflow of 1.5 liter per minute. The animal is placed into box A, to which the test drug or the standard is applied using an ultrasound nebulizer, which provides an aerosol of 0.2 ml solution of the test drug injected in an infusion pump. Then alternatively, the animal is treated orally or subcutaneously also with the test drug or by the standard. Then box B, it serves as a sluice, that is, it's a connector between the box A and box C, through which the animal is being passed to box C. There, in box C, the guinea pig is exposed to an aerosol of 0.1% solution of histamine, that is the spasmogen, histamine hydrochloride, and it is being also produced by the ultrasound nebulizer, and then the time until the appearance of the asphyxic convulsions is measured, and the animal is immediately removed from the inhalation box once this convulsion start developing, and the percentage increase in the pre-convulsion time is being calculated for the particular animal versus the controls, as it was discussed in the other slides also. That is, we are going to find out the change in the pre-convulsion time after the administration of the test drug. Next, we will look into the airway microvascular leakage in guinea pigs. So for this, we are using the Evans blue dye, which can be used to study the plasma exudation in guinea pig airways in vivo. The antagonism against the bradykinin and the platelet activating factor induced microvascular leakage can be studied with this method. So here we are using the dye, that is Evans blue dye. Next is airway inflammation in mice. So bulb C mice sensitized to ovalbumin, which is actually a potent protein of the egg, and they are challenged by repeated exposure to this overwhelming, and it yields marked eosinophilia, means the cells which are increased in case of inflammation, that is in response to the sensitization to an allergen. In the bronchoalveolar lavage fluid which is obtained from the mice, it also has been seen that eosinophil influx varies dramatically in mice of different strains, because different strains will have different susceptibility. For example, strains such as 1 to 9 oblique SV and CBA belong to non or low responders, whereas strains such as SWR C57BL oblique 6 respond to the antigen challenge with marked increase in eosinophils both in bronchoalveolar lavage fluid and also in the lung tissue that is obtained, that can be visualized after doing the histopathology. Next, BALB C mice used for this study are subcutaneously implanted with this heat coagulated egg white. 14 days later, mice are challenged intratracheally with the heat aggregated ovalbumin, and the test drug is administered subcutaneously or intravenously or orally. So this is basically the procedure. Then 48 hours after this antigen challenge, bronchoalveolar lavage fluid will be collected from the animals of both groups, and the total number of eosinophils, neutrophils and eosinophil peroxidase activity will be assessed in the bronchoalveolar lavage fluid, and the animals are then sacrificed, and histopathological evaluation is also carried out. Based on the results of the histopathological evaluation and the bronchoalveolar lavage fluid examination, protection that is being offered by the test drug is being found and evaluated. Now coming to the transgenic approaches, that is basically using the transgenic animals. The transgenic animals are the animals that have a foreign gene, as I have already mentioned, and that is being deliberately inserted into their genome. So genetically modified animals are basically the transgenic animals. Example, we have several mice which can be converted into transgenic models, are considered to be then important models for basic research and to define specific pathways or the drug discovery, and they have been extensively used in the screening methods for asthma. Now coming to the biomimetic models, that is the opportunities of these biomimetic models have been increasing. That is, opportunities afforded by the tissue engineering have resulted in several tissue engineering human airway equivalents becoming available, but still we need the animal models, because these models, that is biomimetic models, cannot fully replicate the condition. So under biomimetic models, we are having microfluidics, then we have in silico modeling, then we have precision cut lung slices. So microfluidics, it refers to a system that manipulates a small amount of fluids using small channels with sizes 10 to hundreds micrometers in size. And microfluidics provide many advantages over the current macroscopic techniques and has been used to microfabricate successfully the blood vessels, muscles, brain, kidney and liver for basic research and drug discovery. Next is in silico modeling, that is using the computer based analysis, that is numerous models have been developed to study basic events such as the molecular interaction, that is binding between the ligand and the receptor, then whole organ functions like bronchoconstriction and aerosolized drug deposition in the lung. And then we have the precision cut lung slices. It is basically ex vivo precision cut lung slices which are obtained from the human lung, and in this the main focus is to assess the airway smooth muscle responses, including hyperresponsiveness, remodeling, that is bronchial remodeling, bronchoconstriction in response to several stimuli such as the allergens, then we have the drugs, and then infection. So this is about the precision cut lung slices. Then we have in silico modeling, then we have microfluidics. Microfluidics is basically dealing with small amount of fluids, and it is also used for microfabricating different structures like muscles, and then we have brain, kidney, liver and blood vessels. Then in silico modeling is basically to study the interaction of the drugs in the computer system. And then precision cut lung slices, here we get ex vivo precision cut lung slices from the human lung, and here we are basically studying the hyperresponsiveness, bronchoconstriction, bronchial remodeling in response to different allergens, in response to different infections, in response to different types of drugs and stimulants. So here you can see the different types of biomimetic models. As you can see, the 2-dimensional cell culture, then we have the 3-dimensional cell culture, which is an advanced form of this. Then we have precision cut tissue slices, and then we have lung on a chip model. This is also an example of the biomimetic model because it is coming under microfluidics, because here we are dealing with small amount of fluids. And finally, even though if we do all these, that is biomimetic models, still we will have to go for animal models, and this is the order of increase of complexity, as you can see, from simple to complex. That is in vivo models, that is in animal models, we are going to study the maximum the actions of the drug. Now coming to the discussion which is related to the animal models of asthma. So animal models of asthma are necessary and are irreplaceable. As I have already mentioned, even though we have simpler methods like biomimetic models, but still we need these complex models to look for the complex physiological process. And experimental data suggests that most characteristics features of human asthma can be replicated in the rats. So the rats can be used and they are also easy to maintain, so we will get an economic advantage also. Next, guinea pig, or perhaps it is the most popular animal model for allergic reaction. So it is being used for the used for the screening of the drugs for asthma and also for COPD. The benefits are that it is easy to handle, and the disadvantage is that there is scarcity of the inbred strains, and also we have less number of strains of guinea pigs. Next, hamster is seldom used in asthma research. It is not used in asthma research. And also the domestic pigs are not used in asthma research, though pigs have several similarities to humans, but the real problem with the pigs is their size. Then monkeys are also considered to be used for the screening of the drugs for asthma, because they have an immune system which is very similar to the human beings, but the problem is they are also difficult to be managed in a setup. Finally, coming to the conclusion, it should be emphasized that any animal model will have both strengths and weaknesses. Its value in answering the particular research question must be evaluated with respect to its relevance to human disease. And no single model is sufficient to draw conclusions on the therapeutic value of a new chemical entity. So basically, we need to do combination of several models, that is in vitro, in vivo models, and the animal models which we are using, that is the different types of animals. So in different types of animals we will have different strengths and different disadvantages. So this is the conclusion of this seminar. So you can go through the references. So these are the references which I have followed, and with this I would like to end this presentation. So I hope you like my content. If you like this presentation, please do like, share, subscribe and comment, and also press the bell icon so as to get notified whenever I upload a new video. Thank you guys.